Good afternoon. My name is Erik Schabert, DO. Welcome back to my channel. And this afternoon, I'd like to talk a little bit more about treatment of diabetes, both type 1 and type 2 diabetes. As a reminder, if you enjoy this content, if you find it useful, please like, subscribe, comment, and share. All right, so this past weekend, I posted a video going in depth into the results of the EDICT trial completed by Ralph DeFranzo, MD, a number of years ago, and what this trial really means for what the optimal way to treat newly diagnosed diabetes is. So that applied to newly diagnosed type 2 diabetics and certainly any diabetic who has not yet transitioned to insulin for treatment. Now I'd like to comment on individuals for whom insulin is a part of care. First, I'd like to talk about treatment of type 1 diabetes. Remember that type 1 diabetics are individuals who do not make insulin in sufficient quantities to control their blood sugars. As a result, we tend to treat it with injections of insulin. Now, we have long seen with type 1 diabetics that over time it becomes very difficult to adequately control blood sugars with insulin without causing low blood sugar, hypoglycemic episodes. As a result, we've long sought additional medications that can be used with insulin to get better results. Recently, we had a small observational study that did indicate that tirzepatide, one of our newest GLP-1 analogs, when used in combination with insulin in type 1 diabetics, can achieve better levels of control with fewer hypoglycemic episodes once titration is completed. This is far from definitive evidence. It's not a slam dunk to say that this is a better way of treating type 1 diabetes, but it certainly is an indication for more study and perhaps an indication on a case-by-case basis to try using something like tirzepatide with insulin in type 1 diabetics that are having trouble keeping their blood sugars under control. Okay, and that moves me on to type 2 diabetics who are using insulin. Here we have a lot more data. We have multiple studies using either GLP-1 analogs, a class of drug called an SGLT2 inhibitor, and pioglitazone, an insulin sensitizer, in combination with insulin in type 2 diabetics. The pioglitazone information comes almost exclusively from Japan, as we don't use that class of medication that much in the United States, something Dr. Ralph DeFranzo has lamented a bit because that is one of the drugs he uses in his triple therapy combination that the EDICT trial tested. So of those combinations, the SGLT2s and GLP-1 analogs have been the most promising. The big advantages of each of these is that it allows us to use less insulin in order to receive or to obtain glycemic control and reduces the incidence of low blood sugar, hypoglycemic episodes. Remember, low blood sugar, hypoglycemia can actually be more problematic than high blood sugar in diabetics. And we have seen in a lot of studies a very strong correlation with increased incidence of heart attack and stroke long-term in individuals who have regular low blood sugar episodes. So any sort of treatment we can do that eliminates that, the low blood sugar episodes, and still lets us get good control of elevated blood sugars, that is ideal. SGLT2s and GLP-1 analogs both seem to help with this. Additionally, insulin, when it is initiated, tends to lead to weight gain. And if we have an SGLT2 or a GLP-1 on board when we initiate insulin, that weight gain doesn't happen. And as a matter of fact, those patients tend to lose some weight. So that is a very positive thing. So one of the things we can consider in any type 2 diabetic who has just been on insulin is adding an SGLT2 or a GLP-1 in order to get better glycemic control. The most commonly used SGLT2 right now, I believe, is Jardiance. And these are drugs that act in the kidney to prevent sugar from being reabsorbed back into the bloodstream. The GLP-1 analogs work on the axis of a hormone called glucagon, which is kind of the opposite to insulin in the human body. And these GLP-1s, by activating certain glucagon-like pathways, it actually suppresses the activity of glucagon while insulin is in the bloodstream. What this does is it prevents the body from mobilizing energy stores to elevate blood sugars while we have energy coming in from food and insulin is active in the body. This obviously can be very beneficial to diabetics. It keeps blood sugars down. It also actually reduces appetite and results in weight loss and does numerous other positive things in the body. So these combinations can be very powerful. All right, folks, that's all I wanted to talk about. If you have any additional questions that this material generated, please feel free to ask in the comments section. I do monitor all my videos for any comments and try and generate replies. If the reply necessary is somewhat complex, I'll just do another video to try and answer the question. Hope this helps, and I will see you next time. Please do remember the contents of this channel are for informational purposes only and to stimulate discussions with your healthcare providing team or help you establish with one. And these do not constitute the practice of medicine. I am not giving medical advice, and in no way do these videos suggest a doctor-patient relationship. Thank you so much, and I'll see you next time.